I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida with the Whitford Thomas Group. Today I'm going to speak to you about anxiety symptoms. When we talk about anxiety, we really look at, anxiety as well as depression and anger and guilt is a very extreme negative emotions. We tend to call those four negative emotions kind of four blocks to happiness. But when we look at anxiety, as we do the other negative emotions, we're really looking at two components to it. One, the thinking component, which is the thinking that drives the anxiety, and then the actual symptom of the anxiety, which would be the kind of behavioral manifestations of that. Interestingly, anxiety used to be a fairly adaptive emotion. In primitive times, kind of the fight or flight mechanism was important for survival of the species. Unfortunately today, or actually fortunately today, we don't have saber-toothed tigers, and oftentimes we're not fighting or fleeing for our life. And so the symptoms today don't tend to be as adaptive. So when we look at the symptoms of anxiety, probably the thing we tend to notice the most is just the physical discomfort anxiety. Oftentimes with anxiety, we see a lot of muscle aches and muscle tension. Also with anxiety, because of the fight or flight mechanism, the body tends to rev itself up, and so you'll get your heart tends to beat very fast, perspiration increases, and as a result, the motor seems to be running very, very fast. Other symptoms of anxiety would be the difficulty in concentrating, staying focused. Oftentimes with anxiety, we tend to avoid confrontation or just avoid things that we kind of view to be too hard. So those are certainly a lot of the symptoms associated with anxiety. The important thing to remember with anxiety, as with all the negative emotions, it's driven by thought. So if you change your thinking, you change your feelings. I'm Dr. David Thomas, speaking to you about anxiety symptoms.